Today's video is going to be on OBS palsy or OBS paralysis. OBS paralysis is the paralysis of the upper limb that occurs due to an injury to brachial plexus. If you want this particular video or this particular topic, that is the OBS palsy or OBS paralysis, to be a piece of cake for you, you have to know the structure of brachial plexus or the formation of brachial plexus. And for that, I already have a video uploaded in this particular playlist itself. So first, check that out. Okay, now I hope that you at least know the basic structure of brachial plexus. With that being said, let's continue with the topic. OBS palsy or OBS paralysis is the paralysis of the upper limb that occurs due to an injury to brachial plexus. So we are dealing with the clinical anatomy of brachial plexus. There are few questions that need to be answered for you to understand OBS paralysis, and they are: number one, where exactly in the brachial plexus does the injury take place? That is the site of injury. Number two, what are the roots of the brachial plexus that get affected during this particular paralysis? The nerve roots involved. Number three, how does injury to that particular point leading to OBS paralysis even take place, or the cause of injury? Number four, what does a person or a patient suffering from OBS paralysis look like, or the presentation of the condition? And number five, what are the muscles that get affected or paralyzed that lead to that particular presentation of the patient, or the muscles paralyzed? So you need to know the site of injury, the nerve roots involved, the cause of the injury, the presentation of the condition, and the muscles paralyzed. Let's start with the first question, and that is site of injury. So in the brachial plexus, there are three trunks. There's your, let me show you here. So there's your upper trunk, middle trunk, and lower trunk. Upper trunk is where 6 different nerves meet, and this particular point is known as the OBS point. Let me show you with the help of a diagram. So there are your C5 roots of brachial plexus and C6 roots of brachial plexus that meet to form the upper trunk. The upper trunk gives rise to two branches. They are the suprascapular nerve and nerve to subclavius. It bifurcates into two divisions, the anterior division and the posterior division. If you look carefully at this particular point, there are altogether 6 nerves that meet. Number 1 is the C5 root. Number 2 is the C6 root. Number 3 is the suprascapular nerve. Number 4 is the nerve to subclavius. Number 5 is the anterior division of upper trunk. Number 6 is the posterior division of upper trunk. Altogether 6 nerves meet at this point, and this particular point is what we call OBS point. So if an injury occurs at this particular point, it leads to OBS palsy or OBS paralysis. What are the nerve roots involved? The nerve roots involved during this injury are C5 and C6. See, here's a diagram of brachial plexus. Here's the upper trunk. There are altogether 6 nerves that meet here. 1, 2, 3, 4, 5, 6, creating a certain point which is called the OBS point. An injury to this particular point leads to OBS palsy or OBS paralysis. So how does injury occur at that particular point? The cause of injury is excessive lateral flexion of the neck. When flexion of the neck takes place laterally in excessive amount, so as you can see, this is the neck and it is flexed laterally. It is flexed laterally. There is excessive lateral flexion of the neck. And plus, if there is also downward force on the shoulder, there's downward force on the shoulder right here, and then excessive lateral flexion of the neck right here, it leads to excessive stretch of the upper trunk of brachial plexus. And when there is excessive stretch in the brachial plexus, especially the upper trunk of brachial plexus, tear might occur. So the ops point might tear, and this leads to the injury of the ops point. Now, this can occur due to various reasons, like during a trauma. Let's say a motorcyclist falls off his bike on his head and shoulder, such that the head and shoulder they go apart or away from one another, stretching the neck heavily. As the neck stretches excessively, the brachial plexus at that particular region also stretches heavily, and the upper trunk with the ops point also stretches heavily, and this might tear the ops point, leading to the injury of ops point and leading to ops paralysis. Second, during birth. Sometimes error during delivery might take place. For example, during birth, the shoulder of the child might get stuck, and due to this, if the head of the child while the shoulder is stuck is excessively pulled, then an excessive stretch is created at the neck, which also stretches the upper trunk, which might lead to an injury to ops point. Thirdly, anesthesia error. When error occurs while giving anesthesia to the upper trunk of brachial plexus, it might damage the ops point or the upper trunk. What's the presentation of ops paralysis? That is, what does a patient with ops paralysis looks like? Let's say the brachial plexus of the left side has been injured. So there's an injury to the upper trunk of the left brachial plexus. Then the paralysis is going to be seen in your left arm. So what are you going to see? First, the arm, it is adducted. So there is adduction of the arm. Second, there is extension of the arm. Third, the forearm, it is pronated. Fourth, there is medial rotation of the arm. This right here is external rotation or lateral rotation, and this is medial rotation. So you are going to see the medial rotation of the arm along with the pronated forearm. And 5, the wrist. The wrist is flexed. So you get a waiter's stiff hand or a policeman's stiff hand. So what are the various presentations? Number 1, there is adduction of the arm. Number 2, there is extension of elbow. Number 3, there is pronation of forearm. Number 4, there is medial rotation of arm. And number 5, there is flexion of wrist. So these are the 5 presentations that you need to remember for a patient with ops paralysis. Here's a small concept for you. During ops paralysis, the affected arm is stuck in a particular position, right? For example, it's stuck in this policeman's tip position. In this particular position, you are unable to move your arm in certain ways. For example, your elbow, at the level of elbow, it is extended. You are unable to flex your elbow. This means that the muscles that are responsible for the flexion of elbow must have been paralyzed, right? Such that the muscles that are responsible for the extension of elbow must have taken over and brought about the extension. So muscles, there are antagonist muscles. So you have a pair of muscles working against each other or opposite to one another. So basically there are muscles in front of the arm that bring about flexus and muscles at the back of the arm that brings about extension. Since the muscles in front of the arm, they have been paralyzed, the tone of the muscles present at the back of the arm, they bring about the extension of the elbow and keep it in that particular position. However, it's not all the muscles for that particular movement that get paralyzed, because it's only the ops point getting injured. So it's only those muscles supplied by the fibers of the injured position that get paralyzed. That is, muscles supplied by C5 and C6 nerve fibers. But again, you need to remember, if you know, at least know the structure of brachial plexus, that there are muscles that are supplied with C5 fibers, C6 fibers, and then some other fibers as well, like C7 fibers. In that particular condition, the C7 fibers might compensate for the loss of function of C5 and C6 fibers. So you have to keep that in mind as well. Okay, enough talking. Now let's get right into the point. That is, what are the various muscles that get paralyzed? Before getting into the muscles, just remember four major nerves that are actually affected. Before getting into the muscles paralyzed, I want you to know four nerves that are affected: your suprascapular nerve, your musculocutaneous nerve, axillary nerve, and radial nerve. These nerves are dominantly supplied by C5 and C6 fibers. Like in case of suprascapular nerve, it's only supplied by C5 and C6 fibers, so it is definite to get injured, right? Definite to lose its function. So suprascapular, musculocutaneous, axillary, and radial. You'll come to know the importance of knowing this now. See, here's my therapy band. Why do I have a therapy band? To show you this. So this is the abduction of arm. During ops paralysis, you are unable to abduct the arm. So the muscles that are responsible for the abduction of arm get paralyzed. And what are those muscles? For the initiation of abduction, you have a muscle right here, which is called the supraspinatus muscle, and it is supplied by suprascapular nerve. So since suprascapular nerve has been injured, the supraspinatus muscle gets paralyzed and you are unable to initiate the process of abduction. Second, the deltoid muscle is responsible for the continuation of the movement of abduction. See, as you abduct, the deltoid muscle gets contracted. So it's the deltoid muscle that continues the movement. The deltoid muscle is supplied by your axillary nerve. So since axillary nerve has been affected, the deltoid muscle also gets paralyzed. Second function. So during ops paralysis, your arm is medially rotated. You are unable to laterally rotate the arm. So what are the muscles responsible for lateral rotation? You have a muscle at the back which is called the teres minor muscle, which helps in lateral rotation of the arm. It is supplied by axillary nerve. Again, axillary nerve has been affected, so teres minor gets paralyzed. Similarly, there's infraspinatus muscle. Up here supraspinatus, down here infraspinatus. So infraspinatus muscle is supplied by suprascapular nerve, which gets damaged. So infraspinatus muscle also gets paralyzed and you are unable to laterally rotate your arm. Number 3, so you're unable to flex your elbow. It is extended, right? So what are the muscles responsible for flexion? The muscles present at the front of the arm. What are the muscles present at the front of the arm? There's your biceps brachii muscle, coracobrachialis muscle. And these two muscles are supplied by musculocutaneous nerve, which has been damaged as well. There is no, your forearm, it's pronated. So there's no supination of forearm. And a major muscle responsible for supination of forearm is biceps brachii muscle. See, when your arm is pronated, your biceps brachii is loose. But once it gets supinated, it becomes contracted. That shows that biceps brachii is responsible for supination of the forearm. So since biceps brachii has been affected, you can't supinate your forearm as well. Then there's flexion of wrist. You are unable to extend the wrist. Since you are unable to extend the wrist, that means the muscles present at the back of the forearm, that extend the wrist must have been paralyzed. And these muscles are supplied by your radial nerve, which has also been affected during ops paralysis.